Thank you, everybody, for being here today. Thanks especially to this extraordinary panel. It's my pleasure to introduce this panel and to talk about a partnership that was crafted just a couple years ago with a grand vision. I'm Brendan Carr. I'm the CEO of the Mount Sinai Health System. This is President Ali, President of Guyana. This is John Hess, CEO of Hess Corporation. And this is Dr. Rachel Vreeman, who runs the global health portfolio for the Mount Sinai Health System. So it's my privilege to be the MC and to keep us tight on time without talking far too much, because all the content knowledge sits right here. I'm going to ask you first, sir, the vision that you have crafted for your country, the vision that you have crafted broadly but specific to health, is transformative and is inspiring. And I was wondering if you would take a couple minutes and just help all of us to understand what you see.
Well, first of all, the vision for Guyana is a very simple vision, and that is really to develop an ecosystem around social services, around the economy that support prosperity for every home. And prosperity cannot only be measured on a monetary scale. Prosperity is access to quality healthcare, quality infrastructure, quality education, and living in a society in which you feel secure, in which you feel your rights are protected, and in which democracy and the rule of law are the foundational pillars. So that is basically very narrowly defining what we want to build. And I will take the component of healthcare. We are working on delivering to the citizens of Guyana and also the citizens of the CARICOM region, because I have made it very clear that the prosperity of Guyana must be the prosperity of the people of the region also. And how do we create a healthcare system that people can trust, that people would want to be a part of, that can meet the needs of the population, and that can also be futuristic? Doing that in a healthcare system that was broken and lacked the key infrastructure require us, first of all, to build out the existing system, to build futuristically on what the healthcare system will need, and also to ensure that technology, digitization, research and development, the training of our human resource personnel, having the doctors, the nurses, to support that healthcare system is all put together. For that, we need partnership. And I think we found the best partnership in Mount Sinai and Hess Corporation, who really played a pivotal role in ensuring that we built a model in which the public and private sector can work together with a great healthcare provider and develop an ecosystem and infrastructure that the best healthcare system can be built upon. And that is exactly what we're doing, targeting the next generation of Guyanese, the children, ensuring that we create a health database for them from day one so that we can track their development, ensuring they're healthy citizens growing up and becoming adults, ensuring that we advance the infrastructure in the present healthcare system to meet our current needs, and also building a sophisticated system that will help the health sector to develop and expand its research capability, and going further into the manufacturing and expansion of the production of vaccines and other important health necessities to meet our requirement and regional requirement.
It's a massive transformation. Even the vision is extraordinary. Actualizing the vision requires, in your words, partnership. So maybe I'll turn then to Mr. Hess and say, the Hess Corporation is known for social impact being central to what you do, in addition to your day job of what you do. Could you maybe talk two pieces, one about this partnership and how it got crafted, but then also, since there's a focus on these sorts of partnerships at Concordia, the lessons learned, and what other entities might need to think about.
Thank you. It's an honor to be here. Look, social responsibility is a core value of our company. Making a positive social impact on the communities where we do business is something I think that differentiates us. It's not just about building an economic legacy, but building a social legacy. So we're very honored to be investing in Guyana and playing a key role in developing a world-class oil and gas industry. But even more important to us, it's to help support the president in his vision in making the oil treasure the people's treasure. And Guyana has amazing natural resources. It's a beautiful country. For those of you that haven't seen it, I recommend it to you. But the greatest resource in the country when you go there are the people. And providing them affordable and really world-class health care is, I think, fundamental to the country's development. So with the president's leadership, and he's modest, but I'll tell you, he's a visionary, and he's very compassionate, and this has been a top priority for him. And so when we started to talk about how can we build a partnership to make this work, as it turned out, Mount Sinai was a dream come true. And I had no idea. I'm on the board of Mount Sinai here in New York, and I had no idea they had an international arm. But I called around and then found out, oh, we actually do this in other countries. And we were lucky enough to have Rachel lead the effort there. And what's happened in 2 years is transformative. We're working on a 5-year plan now. But when you say what's the model here, I think part of it is business feeling a social responsibility and being committed to it, business being a force for good, and then having the unique opportunity of having a leader who has that long-term vision and commitment, as well as a world-class organization as Mount Sinai to modernize the healthcare system. So I'd say this model is a model for developing countries where business, the government, and healthcare system can work together to modernize and bring the standards of healthcare up in a developing country, just like a developed country.
Yeah, but it couldn't have come together easily. It took more than just that one phone call to find out that he was a visionary and that she knew how to do it. Is this a common way that things come together, Dr. Freeman? Is it always a corporate partner, a governmental partner, and then a content expert, a school of medicine, a health system?
I think this really is an innovative model in this sense, as you're saying, bringing together an academic health system partner, medical school, where we have the resources of research and clinicians and understanding of health systems in this way, with a truly visionary both government partner and corporate partner willing to put forward everything that it takes to move that forward. It's incredibly unusual to have the commitment at the level of a president like President Ali to invest in health, where it's not only how do we build new hospitals and modernize our hospitals and make sure that we have top-of-the-line equipment, all of which they are actively doing, but to also say, no, we need to invest in primary care. We need to make sure that every child, no matter where they live in Guyana, receives a comprehensive health evaluation, that we need to put in place the data systems, the digital health infrastructure, not just the fancy computer systems to keep track of it, but truly what does this look like that every single citizen, no matter how hard to reach the region in which they live may be, starts to be able to access the health system in their community. They're investing in the health workforce, training up, and really investing for the next generation what this is going to look like. So it's really been, I think, a unique model for how to move transformation forward quickly and rapidly.
Can I add?
Of course, yeah.
Based on a sentiment of yours just now about how it occurs, how this all came to pass. First of all, I think you have to have a very clearly defined strategy. And as a government, we had a very clear strategy as to what we want the healthcare system to look like. Notice I said system, because it's not a healthcare. Sometimes the population and people are mistaken about what healthcare is. Healthcare cannot be delivered without a system. So your healthcare system must ensure efficiency, reliability, must ensure that procedurally and systematically you have a mechanism that supports healthcare provision. So there is a system that supports healthcare provision. Outside of that, most people would experience healthcare on your first visit to the hospital. And you believe that healthcare is about, oh, I went to the hospital, it took too long to attend to me, there was not enough beds, oh, the doctors took too long to administer something, the nurses were not professional. That is not healthcare. That are services associated with the provision of healthcare. We are very clear that what we wanted to develop was healthcare ecosystem. And the ecosystem is about everything that surrounds quality healthcare provision. You don't want the population to go to the hospital. So you have to start from how do we address primary issues? How do we ensure that we grow a healthy population? How do we ensure that we use the available tools to create a healthcare system that responds to the needs of the people in a proactive way and not a reactive way as to when you visit the hospital? And that is the ecosystem that we are building here. It is much more than healthcare provision. It is building a world-class ecosystem to support healthcare provision.
Yeah, please. 'Cause I was going to say, I'm a CEO of a health system. I'm a health policy guy, and that was a master class on sort of on how it if you.
It's clarity of vision.
It is clarity of vision. We could use a little bit more of that more frequently in our lives. Okay, so but let's double click a little bit, because you've each referenced a few things. You talked about an electronic medical record. You talked about a primary care infrastructure. You talked about you sort of said from the moment you're born, all the way through the end of your life, in some way you're connected to this ecosystem. Sometimes it's a well check. Sometimes it's a preventative screen. Sometimes it's it's healthcare provision. Who best to unpack this a piece of this for me? Which piece are you working on right now? Which piece is the most fun? Which piece gives you the most worries? Pick any of them. Because I heard them, and let me just tell you, I'm the odd man out. They all know each other. They do this work. I met them backstage. I know them individually, except for President Ali. And I want to hear you talk about one of these things that I got to hear backstage.
Well, we have the Minister of Health in the audience. So
you have a what in the health?
He is the Minister of Health.
Yes, of course.
He would have been in the forefront of this. But let me tell you, it's not simple, because we're starting from a baseline. Now, and let me tell you how complicated it is. I said to the team, we must develop a patient care management information system and a health management information system. Now, that is simple. Some people may believe you can go and buy a software off the shelf and you do that. Some people may believe that, you just bring in the technology guys and you put that in place. No, we have to step back and say, first of all, is the legislative details there? Does the legislation that you have, or does legislation exist to support this vision? So we have to start from there. Patient information, how do you protect patient information? How do you ensure that the doctors are going to be professional? What are the standards you're going to set? What are the regulations you're going to set? So that is where the complication came.
Of course.
And Mount Sinai, being in this business for so long, working in Kenya, were the partners that helped us to unlock all of this. And a process that would have took maybe 4 or 5 years in getting those legislations, those regulations, those standards in place, we were able to do in months. And that is where this partnership brought tremendous accelerated success.
So the government, so the governmental perspective on this, that you have to build these foundational components, then the content expert. So the next piece then, Rachel, what's a logical next step as you walk through this enormously complex strategy?
Well, we do have work going on with the government of Guyana and the Ministry of Health in a number of different areas all at once, from workforce training and development to the continued development of the data science and health information systems, and truly at a systems level that are needed, everything from the IT specialists up to the clinical informatics who could really set the strategy for the country with that. We are truly working with the government systems to transform the system into a full system along the lines of President Ali's vision. It has not been the case previously that there would be, the capacity in every community to get, say, screening for diabetes or for high blood pressure, or to be able to access some of those basic medicines and basic services that you might need. It would be required to travel into the capital, to maybe have to take, several hours journey to even get your monthly diabetes medicines, for example. So more and more we've been a partner to the Ministry of Health in their efforts to bring whatever level of services we can right to the communities where people are, and then really free up the national hospital and continue to improve their ability to provide specialty care for when you really do need to be at that national hospital level. One of the things that I personally am most excited about, and everyone here has heard my excitement about this because I'm a pediatrician by training as well, in less than a year, the government of Guyana has launched a school-based health screening program nationally. They started with the nursery school students, who are the 3 to 5-year-olds. And typically there hasn't been a place, and this is not, Guyana's not unique in this. This is true in almost all of the countries around the world. There are often not places for children to get routine evaluations or screening after they are babies and kind of finish their first sets of shots. So in Guyana now, they're starting every year to provide each school-going child with a full health exam, checking their vision, their hearing, looking for dental issues, making sure that they do have that full checkup, looking for learning delays or challenges with their growth, and then creating the referrals and connections so that right there in that community, each family, if there is an issue detected, gets connected into the services that are needed, whether that's glasses for the child who needs it, whether that's dental care moving forward. And in less than a year, this first year of implementation, they've managed to screen 70% of the eligible nursery school students. That's an incredible feat. I've been working in child health globally for more than 20 years. I've never seen a program scale up across an entire country like this so quickly. And we're excited right now, in fact, even as we speak, to be launching the primary school screenings for the kids who are 6 to 12 or 13 years old, and it will then move to secondary school from there.
And Brendan, that'll be over 100,000 students, young children that are impacted. I have to tell you, the work that Rachel's doing with the leadership of the president, it'll bring tears to your eyes. You'll see these children be examined, and then maybe 25% you have follow-up. Well, right there in the exam, if they have a vision problem, they get glasses right there and then. And you see the smile on these children when all of a sudden they have proper vision. Yeah. And you see almost the tears of happiness from the parents. Another example of, just the rapid turnaround time because of the leadership of the government, but also the capability of Mount Sinai is an area like pathology, where, as I understand it, when you had a biopsy, it might take 2 or 3 months to get the analysis, where now it's 2 days. So it's just remarkable work that Rachel and her team are doing to support the president and his vision.
Well, it's wonderful. Can I say the other two pieces, though? I felt like I heard you say there were other essential legs of this stool. Healthcare was one, infrastructure, human capital. I'm wondering either about the workforce side, but then also, what you just described, the idea that you could get all these screening exams done, that these kids are going to school, that you're, decompressing the referral hospital because there's a rural population that needs access. It does feel like it must be synergistic. The health piece must be synergistic with the infrastructure piece and with the human capital piece.
You're so correct, because it is one thing to commit yourself to do the testing. But when you complete the testing and a situation is on your hands that you now have to provide the services to deal with what the results are, then you have to find the resources. You have to have the hospitals. Right. You have to have the capability. And we have committed ourselves to putting that capability in place. And not only for the children, now we are doing 100% national testing for cervical cancer, and we are giving you the treatment if you need treatment. We are now moving to prostate examination. So this is a story that we are building out that is going to be amazing. And also working on, because of how Guyana is, a geographic layout, we may be, by now we have the highest telemedicine station per capita in the region at least.
Wow.
So we're investing in telemedicine, digitization. But what is the litmus test of this relationship? From day one, I said to Mount Sinai, this is not a one-way street. If you're working with us, at the end of this relationship, you must be willing to say that I am ready to attach my name, my brand, to the quality of product that you're delivering. And that is the test. When you have a partner that is willing to say, we're going to work with you, you work with us, and we will have the confidence that we want to attach our brand to what you're doing. And that is a story by itself.
Yeah, So we're winding down, and I'll say, last thought to leave with them. I don't know how you do better than you just did, so I'm going to call on you. I'm going to call on you last. Rachel, one last thought, sort of best story, greatest benefit, or closest to your heart passion project that's a part of this.
Well, I did already talk about the school program, which is definitely.
It wasn't pathology. That's not for the pediatrician.
I mean, I will say, truly, if you or a family member have ever had to wait for the results after, say, you've had a biopsy and you're wondering about a cancer diagnosis, to only have to wait for 2 days rather than having to wait for potentially even months, that is a life-changing change. Not only changing the options for diagnosis and treatment, but truly, changes how your entire approach to that disease and how you're cared for is. I look forward to the day when we can say, every person in Guyana who is diagnosed with cervical cancer, that not only is that diagnosis now starting to happen in the country, but that they're going to receive care there that's equivalent to what they would get anywhere else in the world. And that's something that the Ministry of Health is actively putting in place, the equipment, the training for. Our partners from Mount Sinai are working closely with them in that day by day. And I hope along with that all of the kids will get their HPV vaccines to prevent any new cervical cancer from developing in the future.
It's really brave, and I don't want to lose sight of something that you guys are saying here. You're both saying that we started down the pathway knowing that we didn't have the next 10 steps, but committing to the fact that we were going to build them.
Mm-hmm.
That's right.
I mean, that's really brave. That's really bold. Mr. Hess, sir, is there a lesson for other entities that want to get involved in this sort of work, that want to make a social impact?
I think it's the partnership between government, the healthcare provider, and the business working arm in arm for this vision for future generations. And it makes me proud that our company is part of creating something that I think will be a role model for developing countries. But in a bigger scale, I think the president's leadership is going to redefine responsible development of oil resources to where it benefits every Guyanese citizen.
Yeah, that's a wonderful vision. Can you bring us home?
Well, I just want to take some time to salute the partnership that we have been able to build between Mount Sinai, Hess, and the Ministry of Health, and also the local health providers who have dedicated the time and they are willing to go through the retraining and retooling, because there's a lot of that is going on. Retraining, retooling. Perhaps we have the largest nurse training facility and nurses in training in the region, per capita in the region. We have increased this maybe by 1,000% in just 2 years. That's a number of persons who are doing training in nursing, lab technicians. So the whole ecosystem, the human resource side, the legislations and regulations, bringing together the rules, the procedures, ensuring that all of this is done, whilst at the same time making the improvements to give current result. Because people, you can say you have a partnership, but if someone don't experience immediate results, they say you're just talking. So you have to do things for the future whilst bringing results immediately. And that is complicated.
Well, it's a gift to have the three of you here. Thank you very much. Maybe one last round of applause.
Thank you.
While we say, and I'll close just by saying that in addition to the story of what's actually being done, the playbook that could be replicated for others to do strikes me as, I hope, something that you'll capture as you're marching this forward. I'm not sure we can replicate the three of you, but we can give people some sense of what it takes if you want to march through it. Thank you very much, guys.
Thank you.
Thank you.